But if you want to actually raise life expectancy, I think vaccines do a pretty good job of adjusting that curve upward. And you can't take this a la carte. You picking him is an intentional choice where personnel is policy. And because he's got a long record of being a crank on issues related to vaccines, that takes any of the positive good that you're trying to suggest he might do, which could be done by any number of other people. And instead, you have to own that. You have to own that.
So I think, because you addressed me, I'll just say
sure.
there's a culture war in this country, right, where most people, I think, are in favor of vaccines, but not every vaccine is the same for every condition. So if there are people that are skeptical, which there seems to be a large percentage, then their concerns should be addressed. I mean, how do we know, like if we just look at something else, Venus and Serena Williams, how do we know that they're great tennis players? Because they've been challenged and they've won. So there's nothing wrong with having the science looked at again and people's skepticism addressed. There's nothing wrong with doing that. This is a country based on a marketplace of ideas. And the more debate and discussion you have. Exactly.
So the scientific method would suggest that vaccines, by and large, work, correct?
Well,
or do you disagree with that as a doctor?
I'm in favor of vaccines. But what I'm saying is that if people have, of course, I mean...
But not Bobby Kennedy Jr. isn't. You're here defending him.
I'm defending health care, that I think that a person can still achieve great outcomes even if we disagree about things. I mean, I have every day send patients to other specialties. They're in different specialties. They have different views than I do. I don't expect them to see my patient and then say, oh, yeah, everything Dr. Devi said is right. I don't disagree with anything. Just do that. I expect them to add something. And if they have some concern, I expect them to help me to address that before we achieve a bad outcome.
If we're being intellectually honest, there's really no good reason why Bobby Kennedy, RFK Jr., should be HHS secretary. An advisor, a confidant, somebody who talks to the president and advises, but there's no managerial experience in his resume. There's nothing that says he is qualified to do this job that is in charge of the health of all of us, all these different lanes. If he has views and has insights around food sources, around vaccines, then those should be given in advisory roles.
Why?
Because...
Well, what were the qualifications of the previous ones?
Well, I think it's important to always remember that you put yourself... Say that again?
What were the management qualifications? I mean, Xavier Becerra...
I'm not talking about the previous. I'm looking forward.
But you're calling into question whether he could actually do this job. And I think it's...
Absolutely. I think America is now, and I think
it's important to discuss it, because Xavier Becerra was just a lawyer and a politician with no management experience.
So does two wrongs make a right?
Sylvia Burwell was a Walmart lobbyist. Donna Shalala was a university person. Look,
RFK Jr. is a nut.
Okay, so that's different than what you just said. You just said he doesn't possess the requisite managerial experience, but then we get to the real issue here, which is you want to insult the man, which is your right to do because you opposed him in the election. But you, doctor, are raising the issues that he has been raising, and I think they're appropriate questions to raise. I don't know whether he can be confirmed or not. The vaccine stuff at the table is obviously going to be the flashpoint of this hearing. Mm-hmm. But I'll tell you one thing. This whole issue of the CDC and these public health agencies, look, public trust in the health regime in this country is as low as it's ever been.
But why?
It's because of COVID.
Right.
Because of school closures. Because of mask mandates. Because this country was... But let me just finish. Because this country was drugged through a bunch of condescending and heavy-handed mandates that all turned out to be garbage, and that's why it's low, and the questions are valid.
And RFK is the answer to all of that.
Yeah, I don't know RFK helped promote the assault on the CDC that lowered the disinformation that led to more than a million deaths, Scott. More than 1 million deaths in the United States, higher than any other industrialized nation per capita. That's the result of failed policies, the demonization of the conspiracy theories.
Whose policies?
All right,
under the Trump administration.
John, let me let Dr. Lipkin in, because, again, we got experts at the table. Go ahead, Doctor.
So, first of all, the vaccines we're talking about have been tested